Are your blood tests trying to tell you something your body hasn't said out loud yet? Inflammation could be silently damaging your organs, and your lab result might be the only clue. Today, we are decoding the warning signs hidden in your blood. Welcome to Diagnose, where we simplify lab results, medical science, and biochemistry into clear and practical insights. If you're new here, tap the subscribe button, hit the notification bell, and join us as we break down what your blood is trying to say. What are inflammatory markers? Inflammatory markers are substances your body produces in response to inflammation. Then, when your immune system reacts to infection, injury, or chronic illness, it releases certain proteins into your bloodstream. Now, these markers help doctors detect inflammation even when symptoms are not that obvious. Okay, so now we have common markers, and the common markers include CRP, ESR, ferritin, fibrinogen, IL-6, and TNF-alpha. So I'll start from CRP. Now, CRP, which is otherwise known as C-reactive protein. Now, C-reactive protein rises in response to acute inflammation. ESR, which is the erythrocyte sedimentation rate, it measures how quickly red blood cells settle. A slower rate suggests inflammation. Then ferritin. This is an iron storage protein that can rise with chronic inflammation. Fibrinogen. Now, fibrinogen is a clotting factor elevated in systemic inflammation. IL-6 and TNF-alpha. They are cytokines linked with autoimmune and chronic disease. Why these markers matter? Now, this is another great question. Alright? Now, chronic inflammation is a silent threat, and it is linked to heart disease, type 2 diabetes, cancer, autoimmune disorders, neurodegenerative diseases like asthma. Then, by monitoring these markers, doctors can catch disease very early. They can track flare-ups in autoimmune conditions and even assess risk factors for long-term illness. Alright? Now, how doctors interpret inflammatory markers? Let us simply break down what this result might mean. ICRP. When they are above 10 mg per liter, it often signals acute infections or trauma. Then moderate CRP, between 1 to 10 mg per liter, it may indicate chronic low-grade inflammation, and they are often seen in obesity and diabetes. Elevated ESR, not specific though, but consistent rises can suggest RA, lupus, or chronic infections. High ferritin without iron overload, it suggests inflammation or liver dysfunction. The last one, which is IL-6 and TNF-alpha, they are useful in autoimmune or severe chronic inflammatory conditions. Doctors look for patterns, not isolated numbers. A single elevated result might not mean that much, but consistent changes over time, they are crucial for diagnosis and monitoring and what to do next. If your inflammatory markers are elevated, you need to talk to your doctor. You may need more tests or imaging to find the cause. Lifestyle changes help, anti-inflammatory diets, quitting smoking, and you need to learn how to manage stress. You need to take supplements like omega-3s and turmeric, if advised, may support inflammation control. Regular lab monitoring, which is very compulsory to track your response to treatment. And remember, inflammation isn't always bad, it is part of healing, but when it stays too long, it starts doing damage. Thanks for watching. If this video helped clarify your lab results or health condition, give it a thumbs up, leave a comment, and share it with someone you care about. Don't forget to subscribe to Diagnose for more science-backed health videos that keep your body and mind informed.